What you can see in the lower picture there, that's the top of his head. He was covered with melanoma, and all he wanted to do was die. He was in so much pain, as you might imagine, looking at his lip. His tongue was like that as well. This is a young kid. He was 17, I think, at the time. And cannabis was smuggled into him, and he started to use cannabis. And the picture you see on the right up there, that's after about 1 year of cannabis application, not just topically, internally as well. And his tongue cleared up, and his head cleared up, and he was starting to see again. He was studying and going so that he could go back to school because he was able to read again, and he was practicing the multiplication table. So this is an extreme effect of what cannabis can do.
They used a certain strain, and as you can see, this is profile of cannabinoids, and this work perfect with children because children were very aggressive, and some of them were in hospital, and they were even tied because they could endanger themselves. And after use this strain, they became very polite. They had no problems, and physicians said, we have no reason to keep them in hospitals. So they, at the end, found that it's not in these two compounds. Here is cannabidiolic acid and tetrahydrocannabinolic acid because it decarboxylates, yes. But that there are important also other compounds, and this we must study. Smoking, I think, is good only for patients which need immediate response. These are multiple sclerosis patients, because this I saw really, this is like miracle that patient is on a wheelchair and just one puff and can get up. Without this one puff, he must stay on a wheelchair and cannot get up.
And this is a young lady I've been working with for more than 10 years. She had severe epileptic seizures, and she was brought to me by her mother, who had taken her to Mark Emery's Vapor Lounge in Vancouver. But she was 14, and Mark didn't want her vaping in her lounge at such a young age. So he sent her to myself because he knew I was into standardized oral cannabis. So anyway, I prepped it up into a capsule form, gave it to Mom. She gave it to Haley, and she stopped seizing overnight. It just went flat. And the neurologist couldn't believe it, I couldn't believe it, Mom couldn't believe it. We took her to Children's Hospital. They ran EEGs on her and a number of tests, and indeed a significant reduction in her pre-seizure activity. And this went on for almost 3 weeks, and then she had a little cluster of seizures around her period. And Haley wasn't expected to live past 15 years old. I had the honor of escorting her to her high school graduation. She's now 24. Essentially, her seizure frequency and the type of seizure she was experiencing have completely changed. She still have a cluster around her period. We can't get rid of them all, but a significant reduction.
You can see that the parents reported not only the decrease of the seizures, but also very much improved quality of life, which is much more important maybe than the seizures themselves.
We see relief in many geriatric symptoms and conditions such as internal disease, cognitive behavioral and mood disorder, nutrition and sleep disorder, pain, inflammation, and more. Sleep disorder is segmented into falling asleep and maintain quality of sleep. Cannabis helps treat neuropathic pain by supporting the central nerve system, and patients report significant improvement. It was clear that the patients become less agitated and less spastic, the nutritional index improved, and pain complaints, opiate use were reduced. Patients had a reduction in pain and demonstrate increased quality of life.
we started working with the professional athletes many years ago when we started looking at using cannabis as a substitution for opioids. You can imagine that the athletes were all very eager to understand this because many of them are getting hooked on pain pills during their course of their professional career, and you can see why. It's just, these sports are very brutal. Here's a really interesting visual of this, because you see there's the normal brain on the one side, and then the National Football League players, these are 5 different brains of players in their 40s and 50s. So that's why these players have become interested in cannabis, not just for treating pain, but the idea of cannabis for neurogenesis. There's some clear data now, published data in peer-reviewed journals that confirms cannabis is a neuroprotectant. We have a patient registry for humans and a dog registry, because we have so many people in the US now that are treating their dogs with, the dogs seem to have a very sensitive endocannabinoid system. We have a study that we're doing at Colorado State University with our veterinary college that looked at dogs, treating dogs with CBD. We think that there's all sorts of applications for dogs and cats and horses. You can see not just pain and anxiety, but also we talked about epilepsy. We talk about cannabis as actually curbing cancers in these animals. That's a really fascinating area that needs to be studied more, but certainly we have tons of anecdotal evidence from pet owners talking about this.